Thank you very much, Chairman, Dr. Hiroshi Matsuda and Dr. Hitoshi Miyaoka. Ladies and gentlemen, all speakers, thank you very much for inviting me to this wonderful meeting. And today I would like to talk and share about the reviews of Indonesian psychiatric treatment conditions, the different perspective of public and private service. I work in a Faculty of Medicine, the private sector in Jakarta, and also as a head of psychosomatic clinic in Omni Hospital in Tangerang, the satellite city near Jakarta. So I would like to acknowledge my colleagues, Dr. Eka Fiora and Dr. Darmawan Purnama, who helped me with the slides. So before we go further, I would like to make a review about Indonesian, and we have a more than 250 million populations by 2013. We have 34 provinces and divided to 403 regency or districts and 98 cities. So by the Basic National Health Survey in 2013, with the populations about 236 million, we know the mental health problems in Indonesia, the most prevalent are mental emotional disorder related to anxiety and depression. And the severe mental health problems like psychotic and schizophrenia is about 4,000 people. And the problem in Indonesia is many of the psychotic or even the severe mental health problems has been shackled or restrained, and there's about 57,000 people with mental disorder, with severe mental disorders, has been shackled for their life. So the problem is also the treatment gap in mental health problems. This is the numbers of treatment gap for psychosis in one biggest city or province in Indonesia. And you see that about 1960.5. So it means below 5% of people with mental disorder has treatment for their psychosis, and it is very surprisingly for us. What do we face in our daily practice? Many patients with the mental disorder, we know there's a stigma, discrimination. So what we are today going to talk about, the treatment also, it's treatment gap, and also limited access to treatment. In Indonesia, there is no private insurance that cover mental health disorders and even psychosomatic patients. And in professionalism, we know that small numbers of psychiatrists are in Indonesia now. So this is the face of Indonesian in media, especially in abroad media. People talk about discriminations, people talk about the mental health problem, and shackle is one of the Indonesians' shame that has many problems with this. So we thank to God that in July 2014, Mental Health Note was approved by Parliament of Indonesia. And this is one of my colleagues, Dr. Nova Rianti Yusuf, who supports very much to this beginning of time when we proposed the Mental Health Note in Parliament of Indonesia. This is a preview of Indonesian conditions. By 2014, we have about 1,700 general hospitals and 9,000 community primary health clinics. 2014, we began national insurance system managed by government, but not really work now. Still many patients do not cover this insurance because it's a voluntary also. And about 800 psychiatrists, about 840 psychiatrists now in Indonesia, with the populations about 250 million, produced by 8 departments of psychiatry. In Indonesia, we are university-based, so psychiatric training is in the university hospital, basically not in a private hospital or in the general hospital like in the United States or in the other country. In Jakarta itself, there are about 300 psychiatrists, so there's a discrepancy in numbers of psychiatrists in Indonesia. We have a 38 state and local governments mental hospital. There are only about 1 mental hospital in Jakarta and 1 in my hometown in Tangerang. So, what about the general hospital that has psychiatric ward? There are only 2 private general hospitals, and 1 Central National State Hospital, also is a teaching hospital in Jakarta, and 1 Central Army Hospital and 1 Central Police Hospital. In Indonesia, there are many shelter houses, sometimes act as a small mental hospital for chronic or even an acute phases. This is not the medical approach. Many of the many shelter houses is approached by the religious or even a traditional way to cure mental illness. Shelter houses also called mental rehabilitation houses in many part of the country. In 2009, my colleague Dr. Dan Hidayat from my faculty made a study about the prevalence of mental disorder among patients who came to public community primary health clinics with somatic complaints. We want to see that patients that come with somatic complaint to the primary health care, especially with the problems with the somatic complaints, are also suffer from mental disorders. It's about 31.8%. And they diagnose this with depression, anxiety, and somatoform disorder. This is the mental health service system that proposed by Ministry of Health today, and we are going to, from mental hospital to the society or to the public health care, and we are going to strengthen this psychiatric service in community primary health clinics. Because of the approval of the mental health laws, we are starting now mental health reform in Indonesia, and this is an ideal of mental health service. It should be effective, appropriate, efficient, responsive, accessible, safe, continuous, and capable. So maybe in the future we want to reduce of the many shelter house that has no background in medical approach, but replaced with a more scientific or medical or psychiatric approach to these kind of things. So this is the modern mental health service. We all know that there is a case manager, not only related or depends on the mental hospital. In Indonesia, because of the stigma also, when people suffer from mental disorder, they are reluctant to go to psychiatrists. They are prefer to go to the maybe psychologists or even other physicians, because they think if they go to psychiatrists, somebody will tell they are crazy. So what is the reality in the real practice of psychiatric treatment in Indonesia? When we are talking about the public mental hospital in Indonesia, they have a program of promotion. They have a program of prevention also. They have a program of treatment and rehabilitation. But when compared to private psychiatric practice, they're only focusing on treatment of mental disorder. I myself, in everyday daily activities as a physician in my hospital, has a little portions of rehabilitation, promotion, and prevention. As you see, that only 2 private hospitals, general hospitals, that have psychiatric ward. So many patients with the need of hospitalized will be denied by the hospital, and they sent to the mental hospital. So the private psychiatrists in general hospital, this is the real what happened in our daily practice. They have to pay for service system. They don't have any insurance. Most of the company, especially in company with oil and gas, they cover also the service of mental health or the service of psychiatric, but not all the company. And many hospitals see psychiatrists as non-benefit specialists to hospital, because there are a lot of mental health hospital in the past, but now changed to the general hospital. And only 2 private hospitals that have psychiatric ward for inpatient, and psychiatric patient in private hospital sometimes see that they don't need any kind of further treatment, or reluctant if they would refer to the mental health hospital. So for talking about treatment in psychiatry and how we can rely on the primary health care also, because of the lack of the number of psychiatrists in Indonesia, we have to see the psychiatric educations in Faculty of Medicine in most university in Indonesia. We define undergraduate and clerkship program. To achieve the Bachelor of Medicine, it needs about 3.5 years. In that kind of stage, we have only about 3 weeks to teach the medical students about all the diagnosis of psychiatry and treatment. And clerkship, about 1.5 years. Internship, after they graduate as a doctor, they have to go to rural area in Indonesia for 1 year. The undergraduate, we talk about theory of psychiatry, life cycle, diagnosis and treatment of mental disorder, and a brief psychiatric interview for the skill training. And the clerkship program, they have a tour of duty in mental hospital, mostly in general hospital, public mental hospital or general hospital with psychiatric ward, focusing more in severe mental disorder or inpatient patient ward. And so not many students see patients with neurotic disorder, like major depressive disorder, anxiety disorder, or somatoform disorder. But when we talk about the competency standard book for general practitioners by 2012, general practitioners' competency in dealing with psychiatric disorders proposed by Indonesian medical associations, they can only treat insomnia in the private or in the primary practice. They can only deal with the somatoform disorder. So can you see the discrepancy in this kind of treatment in Indonesia? So what do I do? Because we know that there is a lack of number of psychiatrists in Indonesia, we rely on primary psychiatry, but also the primary physicians to get more attached with the patients with a problem in psychiatry. So what are going to do? What are going to take responsible for that? So I held update in psychosomatic medicines for general practitioners every year since 2012, begin in 2011 actually. I held a periodic discussion with intern in my hospital about topics related to CLP, because we know that the problems of mental disorder is not simple, and because of the limited time when we're dealing with the clerkship program or in the lecture, so I gather a journal reading club for students who interested in medical disorders and also in mental disorder. For the educations for the people, lay people, actually I write blog, website, I tweet, I become a source person in media, and also in public seminar for lay people. I have also 2 non-fiction books, Psychosomatic, Indonesia, and Psychosomatic, and Don't Call Me Crazy. It's about a book to destigmatize the patients with mental disorder. And so this is what I do. I join with the media, become a source person. I go to school also to talk with them, to talk and then treatment. So lay people will understand that the most important thing about related to the diagnosis of mental disorder is not really very, don't have to be afraid to go to psychiatrists. So this is also to give what we call to take attention from the media and also take attention from the government. I read an article in national newspaper, one of the title is Corruption is Mental Disorder, and talk show with lay people, and also have books, and also have regular seminars for primary physicians. So for the conclusions related to mental health issues in Indonesia, we know that there is a lack number of psychiatrists. From previous speakers today, we know that in Indonesia only 800. In Japan, there are about 16,000 psychiatrists. In America, there are about 40,000 psychiatrists. We are the biggest archipelago in the world because huge area of services, discrepancy in the number of psychiatrists in each residence and each district. We still fight with discrimination and stigma, also from the related to government and also from the insurance company. We see that the problem is also in discrepancy in psychiatric educations in medical school. And we know that we need more efforts to promote the importance of psychiatric treatment, but also to promote that the diagnosis, the early diagnosis of mental health problems in primary care and also in the community and in the society is more important. Because one of my professors said that the most important thing in psychiatry is diagnosis, diagnosis, and diagnosis. Thank you very much for your concern and your attention, and this is my contact number. If you want to to contact me, please. Thank you.
Thank you very much for very informative